How to protect your neck and back disc is the subject of this video. Here I'll answer questions like what causes cervical disc and lumbar disc problems? How can you keep your spine healthy and pain-free? What are the best exercises for supporting spinal disc health? And how do poor posture and daily habits affect disc health? And finally, what's the difference between cervical and lumbar disc issues? So let's begin. First question, what causes cervical disc and lumbar disc problems? Well, while injuries and poor posture play a role, in my practice, I see that used to be the old mindset, but now I see things like fixated posture. So that means that you're sitting behind your desk doing the same thing over and over, day in, day out. That is the fixation at your joints, and it takes away that mobility that your spine is to have, and it makes it more and more limited. That limitation comes with biomechanical alterations, the way you move around, and therefore a movement or movements that used to be safe now become more risky because you are more rigid. So these are really things that you should be considering. It does not have to be an injury per se, like this incident happened and that happened. Poor posture happens as a result of collection of all of these things showing up in your body. So poor posture is not something, it's not a pathology or something that you contracted. It is an insight as to how well you're moving and how well you're holding your body. How can you keep your spine healthy and pain-free? Well, movement is so critical and so essential for us. Regular exercises, but you got to understand when it comes to exercises, we're not talking about taking your tired body and working them out. And we're not talking about isolated exercises. Ergonomic adjustments are so important. How your setup is at work or home makes a huge difference. How properly you go about challenging your body with things like sitting to standing, squatting, lifting. These things are so important and make a huge difference. Some of the exercises for supporting your spinal disc and health, the ones that I 100% see value in, are developmental exercises, the same exercises that got us from helpless infant to become running toddlers. These are exercises that always involve the whole body with the spotlight on a specific area. These are developmental kinesiology movements that we're talking about. Low impact activities like swimming, very important, and anything that allows your trunk strengthening exercises or stability make a huge difference. When it comes to trunk stability and how well your trunk dances with your upper and lower extremities, these are the things that allow us to have an overall functional movement. And the one practice, the one exercise that puts them all together and allows stability of your posture are the developmental exercises. How do poor posture and daily habits affect your disc health? Very easily, like I mentioned before, sitting for long periods, slouching, sedentary lifestyle, which is more than just sitting, it's sitting to standing. These are some of the daily habits that lead to poor body mechanics and poor posture and affect your disc health. Your disc is between two vertebrae with, it's like, I call it, it's kind of like bagel cream cheese. The cream cheese is the disc. Of course, your disc is not the consistency of the cream cheese, but you get the point of what I'm trying to tell you. It's sandwiched between two bony parts. So when there's a biomechanical alteration, then it's reasonable to damage the disc. What's the difference between cervical and lumbar disc? Well, other than the fact that one is in the neck and the other one is in the lower back, you can see that the one when we have issues with the disc in the neck, you may not have radiation or pain going down your arms versus your legs in the lower extremity, depending on the location of the disc and the degree of the disc herniation or disc disease, and whatever else that may exist. You can impact the function of your organs because your organs are also being innervated or being they get their nerve supply from your spine. So for instance, you can have disc herniation or disc issues in the lumbar region, and you can have issues with your bladder function, or you may have issues with sphincter function. So it really depends on that. That's why it's so important to look at the whole body and the whole health holistically. Look at the whole global aspect and presentation of the whole body. And when it comes to analyzing a problem, to look at it beyond just the nerve. What else is being innervated or is being controlled by this nerve? How is this disc issue different than the other disc issues? When it comes to the treatment, we want to, or pursuing the cause, we want to ask, well, why did it happen in this disc and not the other disc? Why did it happen in my neck and not in my lower back? You want to keep asking the right why questions to not only address the reason behind what happened, but in order for us to be able to treat the root cause and treat the problem effectively, we want to be able to address all of those things. Hope that this made sense to you. Please make sure you like and comment, and make sure you share with other people. And until next time, take care.